Hello, greetings. Myself, Dr. Prashant Kumar Rai, Gastro and Liver Specialist at Apollo Excel Care Hospital, Guwahati. So today I'll be talking about a very common gastrointestinal problem, constipation. So being a doctor, I can say that almost 50% of my patients do suffer from some degree of constipation. So constipation is a very common clinical entity, and in fact, in various studies, it has been estimated that the prevalence of constipation is anywhere around 15 to 40% depending upon the diagnostic criteria used. Constipation in majority of cases is not a very life-threatening disease, but yes, it can impair one's quality of life by affecting the physical and mental well-being of the patient. But in a small fraction of patients, constipation can be associated with some serious underlying gastrointestinal diseases, which needs early diagnosis and management at the earliest. So in the next few minutes, I'll be talking about what exactly is constipation, what are the risk factors for constipation, what are the causes, what are the alarm features, and how to manage and treat constipation. So starting with what exactly is constipation. So constipation can have different meanings to different people. Usually, constipation implies any one of the or more of the following symptoms. First, decreased urge leading to less than 3 bowel movements in a week. Second, excessive straining during defecation or during passing of stools. Thirdly, using manual maneuvers like massaging your lower abdomen or using finger to remove the impacted stool at your anal orifice is also a symptom of constipation. Next is passing hard and lumpy stool. And last one, feeling of a sense of incomplete evacuation even after passing stool. You feel that something is still inside your bowel and you do not feel a completely relief. So all these 5 symptoms, if one or more of these symptoms occur in one, then that patient is suffering from constipation. So next we'll be talking about what are the risk factors. So there are several factors which increases the risk to develop constipation. The first one is age. Although constipation can occur in any age group, but it is seen increasingly commonly with advancing age. So much so that almost third of a patient more than 60 years of age. Dietary factors. So if you're taking low fiber diet, large amount or excess of caffeine and tea, you are more prone to develop constipation. Similarly, if your water intake is very less and you are eating more of junk foods and processed food, then there is a high risk that you will be developing constipation. Next factor is your lifestyle related. So if you are living a sedentary lifestyle or very less of physical activity, then there are chances that you may get constipation. Similarly, if your sleep is not adequate, you have a very erratic work schedule, you are doing too often night shifts, then also this may lead to constipation. Physical and emotional stress in life also do contribute in development of constipation. Next factors are improper or faulty toilet habits. So if you are ignoring the urge to defecation or you are delaying it for later on, then this is not a good practice and this may contribute for development of constipation. Similarly, if you are, nowadays it's very commonly seen that we often take phone or newspaper in the toilet. So this is not a good practice again because it kind of disturbs your concentration and it decreases the sensation as well as it leads to incoordination of the rectoanal muscle group which helps in defecation. The other factors is your use of several medicines. Several medicines are known to cause constipation like antihypertensive and various antidepressant or iron supplements or antacids. So these all drugs, if you are on these drugs, your constipation may be because of this, and you need to tell your doctor about these medicines. Next, we'll be talking about what are the causes of constipation. So, there are various medical conditions and diseases which can directly cause constipation. So, first one is neurological problems. If you are suffering from any problems of nervous system, be it like spinal cord problems or brain problems, for example, stroke, Parkinsonism, multiple sclerosis or spinal cord injury, then you may suffer from constipation. Secondly, there are other diseases which are not neurological, like which may or may not be neurological, like diabetes, hypothyroidism, eating disorders like anorexia nervosa. If you have very low potassium level, then these may cause constipation. The third group of causes are your luminal causes or your intestinal bowel causes, exactly. So what these are called as luminal obstructive pathology. Basically, these may be some polyp or tumor or narrowing obstructing the passage of your bowel, so that the free passage of the stool is impaired, and this may lead to constipation. Other causes are drugs, as I have mentioned before, especially drugs like antihypertensive, antacids, iron supplements, antidepressants. So all these drugs can cause constipation. Next group of causes is basically a different entity which is called as irritable bowel syndrome. It is very common in young age group, and constipation is seen very often, but abdominal pain is other predominant symptom of this syndrome. Next group is idiopathic constipation, which means constipation where there is no apparent structural or any apparent diseases, but still you may have constipation, and that too long standing. So this is called as idiopathic constipation. The last group is a special kind of problem where there is basically incoordination between your rectal and anal muscles. So basically during defecation, that is when you expel the stool out of your anal orifice, what happens is the rectal muscle contracts and the anal sphincter relaxes. So this expels the stool out of your anal orifice. So if these muscles are not working properly, or if the rectal muscle are relaxing or anal sphincter is contracting, then this may lead to a kind of a special type of constipation which is called as dyssynergic defecation. So all this can lead to constipation. Now next we'll be talking about what are the alarm features, or what are the symptoms and signs which you should be aware of, which can depict a serious underlying condition, and you should be immediately consulting your doctors. So these alarm features are: first, a new onset unexplained constipation in elderly group. When your age is above 45 years and you have developed a new onset constipation which was not there previously, then you need to consult your doctor at the earliest. Secondly, if you are seeing blood in your stool, then also again this is an alarm feature and you need to consult your doctor. Thirdly, you have a family history of colonic cancer or colitis. Fourthly, if you have developed anemia or iron deficiency, then you need to undergo some investigation and you need to consult your doctor. Similarly, if you are having severe abdominal pain, persistent vomiting, or you are feeling somewhere in your abdomen some lump out there, you need to consult your doctors immediately. So these are all alarm features or red flags. If these are present, there might be some serious underlying condition and you need to visit your doctor as soon as possible. Okay. So next we'll be talking about how to manage and treat constipation. So basically the management of constipation comprises dietary changes, lifestyle changes, some medicine which are called as laxative, and behavioral or biophysical training. So if you have mild constipation, the constipation which is like not very often present and it's not impairing too much of your quality of life, and there is no alarm features, you can try some home remedies or home measures only before visiting the doctor. So what home measures you need to take? First, dietary changes. Increase the fiber intake in your diet. Fibers are mainly found in cereals. Try to take whole grains, legumes, nuts, seeds, seasonal fruits and vegetables. So all these contain a high amount of fiber. You need to take between 20 grams to 30 grams of fiber. This may kind of soften your stool, and this may, in mild cases, this may also relieve your constipation. Secondly, you need to increase your water intake. In winters, you need to take around 2 to 3 liters of water, and in summer, around 4 to 5 liters of water. You need to change your lifestyle. You need to have an active lifestyle, incorporate exercise in your daily routine. Avoid caffeine, too much of caffeine and tea. Cut down on alcohol and smoking. Adopt a proper toilet routine. Don't take your phone or newspapers while in the toilet. Use, if you're constipation, if you're using Western toilet, if possible, convert it into, or try to use the Indian type of toilet, because Indian type of toilet, it corrects your angle between rectum and anus, so, and thereby facilitating the passage of the stool through the anal canal. So Indian toilets are more more constipation friendly. Next, if you're, despite all this home measures, you are not getting relieved into constipation, and especially you have alarm features, then you need to consult your doctor. So your doctor will advise you some investigations, that may be some blood investigation, especially to rule out diabetes or thyroid or low potassium. He or she may also go for some neurological examination and imaging in order to rule out some neurological problems. Also, you may also undergo a special type of investigation, that is colonoscopy. Especially if you have a family history of colonic cancer or colitis, or you have alarm features, then you need to have this investigation, that is colonoscopy. Your doctors may, after that, after evaluating you, he may advise you some medicine. This group of medicine is called laxatives, and there are various types of laxatives, for mainly like osmotic laxatives, stimulant laxatives, and or bulk forming laxatives. So your doctors may prescribe any one or more combination of these laxatives. These have varied mechanism of action. They may soften your stool, they increases the bulk of stool, some may draw water from your intestinal wall, and some may stimulate the movements in your bowel. So all this medicine are called as laxatives, and most of them are safe, but do take them only when it is necessary and with the advice of your doctor. Next is behavioral therapy. In this, I would like to mention about a therapy called biofeedback therapy. Here, basically, this is especially useful in dyssynergic defecation, when your rectal and anal muscles are not working in tandem. So basically, in this therapy, you are trained to use your muscles correctly. So this was the treatment for constipation, and basically that's all for constipation today. And again, thank you.